Brid Smith.
I just want to say at the outset that I think we're witnessing a serious attempt to pass the parcel here today from all the witnesses. And I don't think it's a failure of any one particular body, either the Nursing Homes Ireland, HIQUA, the HSE or the department. At its heart, this is a gigantic political failure of our elderly. Since the late 1980s, we have been privatising care of the elderly. It was described by the Ombudsman in a report in 2010 as a creeping move towards privatisation that has now become a gallop, so that we have a reversal of what we had in the 80s today, which is 80% of our nursing homes in the private sector and 20% in the public sector. So I don't think there should be any attempt by anybody to say it's not me, it's them, or it's not them, it's me. All are to blame here. And I want to point out to both the HSE and HIQUA that I find this very similar to the Ruth Morrissey case in the question of cervical check. And the court was very clear in the Ruth Morrissey case when it said that you cannot argue that because you contract out or subcontract out the care or a service, that does not mean that you are responsible. And both HIQUA and the HSE accept that they refer patients to private nursing homes, but you cannot evade the responsibility for what has happened here. Now, I have a couple of questions. The first couple are to the HSE. I believe David Walsh, you're a member of NEPHET, is that correct? And as a member of NEPHET, we went through the NEPHET minutes, and the first mention of care of the elderly in the NEPHET minutes, which is a committee that was meeting since early January, was in early March. Can you tell me, please, when did you decide that this was an issue for NEPHET?
Well, Deputy, I can confirm that I joined NEPHET for the first time, I think, on the 10th of March. So my knowledge of proceedings starts at that point in time. And
were you brought on to NEPHET specifically on this issue?
I was brought on as a senior operational manager within the HSE. My understanding is at the time there was a decision to broaden the membership of NEPHET to incorporate a sort of broader perspective. And at that point, I'm not sure who else came onto it at that time, but I think certainly both...
It's fine, Mr Walsh, because I will run out of time. But it's clear that prior to your coming onto the committee, then there's no mention of the care of the elderly on the NEPHET minutes. And despite this being a global phenomenon, it seems to have gone under the radar. My second question to you is, in the first 3 months of this year, 2,500 people were transferred from acute hospital settings into nursing homes under the Fair Deal scheme. Can you tell me how many of them were tested for the COVID virus before they were transferred?
I can't, Deputy. I don't have that detail.
Well, could you get that detail for us? And I find it surprising that you don't know how many patients would have been moved from acute hospitals to nursing homes with either being tested or not being tested.
There's a couple of questions within that, Deputy, including when testing first became available, but I'm happy to follow up for you.
Thank you. My next questions are to HIQUA. Sorry, just give me a second. Where do I put them? Yeah. In your statement, you say you told the HSE about specific homes. What specific homes did you warn them about, or did you warn them about specific homes, and what action did the HSE take on foot of that? You also say in your statement that you told the HSE where the homes are. And do you mean where all homes are, that you were saying globally this is where they are all over the country? And if you did you highlight what particular homes you felt might struggle more than others based on your previous inspections, especially the information around the 18% or so that failed the inspections?
I'd ask that in particular institutions not be named if possible, but the rest of the question...
It's fine.
That's good.
Certainly, in relation to, I suppose, the first part of your question, which was which particular homes, that was those homes that had made contact with us that were struggling in relation to, I suppose, coping with the virus within their specific homes. So at that point we were, I suppose, referring specific issues into the HSE for support. In relation to things like the location of homes, certainly that, yes, gets to the heart of, I suppose, what I was saying earlier, that the HSE aren't familiar necessarily with the entirety of the sector, so we did supply them with the locations, with the numbers of residents, with the numbers of staff, etc., you know, within those homes. Yeah. Sorry. No, it's just that I suppose I also wanted just to reference the point that my colleague had mentioned earlier, that she had provided to the department as well a list of high-risk homes.
Thanks. Yeah. Ms. Toohey from the Assistant National Director for Older Person Services wants to get in, I believe, to answer your question, Deputy Smith. Is that correct? Sorry, I was told by the Secretariat that Sandra Toohey wished to speak, but if I'm incorrect in that, we can move on. Okay, we can move on then to... you are out of time. Well, the reason I intervened was because you asked them to name particular people. You're in the chamber longer than I am.
Are you now testing staff in nursing homes as they enter the job? Before staff take up roles in nursing home, are you testing them?
I didn't hear the start of the question, Deputy. I'm sorry.
Until the 12th of March, you were not testing staff in nursing homes. Then the testing started after we raised the issue here in the Dáil. Are you now, this day, and currently testing staff who enter nursing homes to take up a job?
I'll ask Dr. Kennelly to answer that, if I may. Thank you.
Deputy, thank you. I think it's very important that, and one of the opportunities really here is to kind of highlight the limited role that that kind of testing approach actually has. Unfortunately, the way it actually is with COVID-19 testing is that you can test negative for it today and be positive for it tomorrow. And we have learned hugely through the risk.
I'd ask you to be very brief in your answer and maybe we've an answer by way of correspondence.
Yeah, we've learned hugely about the disease in the course of the pandemic. We know that asymptomatic transmission...
I don't know whether it's a sound problem or a more general communication problem, but I just ask maybe that you're very brief and provide a more detailed answer by way of correspondence.
Okay, that's fine. Just to say, it can't be a blanket yes or no answer, because actually testing doesn't work that way.